Hi, I'm Dr. Scott Klein, Chief Medical Officer here at Blythedale Children's Hospital. Normally, the best way to get to know what Blythedale does is by coming here on a tour. Unfortunately, these days, it's not something that we can do, so we're going to try to show you the best we can by doing this virtual tour and show you the building through our eyes. Blythedale is made up of 2 floors with 94 beds. Our first floor is our infant and toddler unit, and that's where most of our complex infants go. Infants on ventilators, infants with short gut syndrome, post-cardiac surgery, anything you can kind of imagine that would be involving an infant really needing intense medical services as well as rehabilitative services. Our second floor is what we call our pediatrics unit, and that's also where our brain injury unit is as well. On this floor, you really see the full gamut of things that could impact a child. Anything from post-surgical needs, brain injury care, cardiac surgery, oncology, cancer, transplants, anything that really you would see a child in a PICU or a med-surg unit would typically come to this unit. In order for us to take care of the types of kids that we have here, we have extensive medical and nursing services. For physicians, we have in-house pediatricians 24 hours a day, and we have services, as you'd expect, to be able to take care of the highly complex kids that we have. So we have pediatricians, neonatologists, pediatric physiatrists, pediatric pulmonologists. So with that, we have a pod structure here that allows us to have a mini unit where each of the rooms are in front of the nurse's station, which is important for the parents, and it allows us also to respond as quickly as possible if there's emergencies. We have a full RN staff. We have a medication area where the nurses can prepare their medications. And we have an on-site compounding pharmacy, which allows us to make infusions. We can do chemotherapy if needed. And especially for the kids coming to us with pulmonary hypertension, they can do infusions or other treatments that would be needed for those kinds of children. And we could do TPN as well. One of the big differentiators for a place like Blythedale is the ability, first of all, that we're piped in for gases at every bedside. So what that means is we don't have a ventilator unit or separate areas. We can put a ventilator at any bedside. So any of our 94 beds, we can have a ventilator going, and we're piped in for all the different gases. We do ICU ventilators, we do portable ventilators, and we do the newest portable ventilators that often have the capabilities of an ICU ventilator but can be portable such that we are able to have the child no longer tethered to the wall and be able to participate in activities. Beyond that, we have all the monitoring that you'd expect for a facility like Blythedale, but even more given the fact the type of kids we have. We can do continuous pulse oximetry, we'll do Untitled CO2, whatever is needed in order to be able to safely monitor the child and to be able to direct how we do monitoring and weaning. We can do other technologies, peritoneal dialysis, we do VAC systems, and we'll even do infant peritoneal dialysis and infant VAC as needed. A major contributor to our success here are our therapists. We have respiratory therapists that are here 24 hours a day that help us with management of the respiratory needs and weaning. And then we have over 85 physical, occupational, and speech therapists that are special in the sense that we consider ourselves tertiary rehabilitation, and they're able to do this caring for the most medically fragile of children. They're able to really work with kids on ventilators, work with kids with brain injury in a way that you would not normally see in an acute care hospital. At the heart of any children's rehabilitation hospital is where the children actually receive their therapies. In the Milton Spine Therapy Village, the site was built with the idea that children are going to work and play in an environment that's fun and bright and colorful, because for children, so much of what we try to do is make play as a way for them to have therapy. But even more importantly, they're here with their peers. It's kids like them going through similar issues. We have a sensory room with a climbing wall. We have a safe gait dynamic mobility trainer for children that have spinal cord injuries. And we even have an activities of daily living room where children can learn to work with a microwave or get into a bathtub or work with chairs. Overall, it's a space that really is geared towards the children that have the most complex of rehabilitation needs and is designed to be there for the future. So for our older children, They need the ability to express themselves through play and interaction with their peers, socialization. And so we have a full department of child life specialists and therapeutic rec specialists who work to help the children not only cope with their illness, but really just enjoy their time. The kids are out and about. They're using the hallways, they'll ride bicycles, they'll play basketball, they're interacting with each other. We use the building as part of their therapy. And it's really a wonderful place to be, and one of the great things that when you come to Blythedale and you see is so different than a typical hospital. One of the many unique things about Blythedale is we actually have our own on-site school district. The Mount Pleasant Blythedale School District is a K-12 school where the children that go here are in some way a patient at Blythedale. Our inpatients have the ability to come here for school, but we have about 120 kids who come in from home every day, bussed in by their local school district. The idea is that they have some sort of extensive medical or rehabilitative needs that are too difficult to meet in the community, and so they can come here, go to school, while also receiving their therapies. But for our inpatients, what's really amazing about it is it's a great way for children to continue the really important socialization and development, as well as education that's really necessary for children to thrive. As the only certified pediatric traumatic brain injury unit in New York, we actually have several NIH-funded brain injury research studies that are really looking at how we can make a big difference for children in their outcomes, but also help understand more the trajectory of recovery and help then guide treatments that help move that trajectory in a better direction. For the brain injury program, having the ability for our neuropsychologist to observe the child in a classroom setting, and then on the reverse, have our teachers be able to observe that same child on the inpatient setting is a great way to make sure that the child is able to make that transition to the classroom, and ultimately when they go home, they can continue to attend our day hospital program with our school, and then ultimately transition fully back to their community school. All of this is a way to really make sure that the children have the best opportunity to improve not only their physical function, but their social and neurodevelopmental function as well. So we're now inside the brain injury unit. You can see that we have a pod-like structure here. And the idea of our brain injury unit is that it's volume controlled, low stimulation environment that's really important for our kids that are recovering from brain injury. Now I'd like to introduce you to our unit chief of the brain injury unit, Dr. Kathy Silverman.
Hi, I'm Dr. Kathy Silverman. I'm unit chief of the Brain Injury and Adolescent Units here at Blythedale Children's Hospital. I've been practicing medicine for the last 25 years, and I've been at Blythedale Children's Hospital for the last 20 years. I'm board certified in pediatrics, and I did a subspecialty in adolescent medicine. Our newly renovated traumatic brain injury unit now accommodates 18 patients, and this expansion enables us to better meet the specialized needs of children and adolescents recovering from a brain injury. We see a variety of different brain injuries: traumatic brain injury, post-infectious, encephalitis due to autoimmune disorders, brain tumors, vascular injuries, strokes. Our traumatic brain injury unit also provides a dedicated therapy room where we can work with patients who need PT, OT, and speech in a quieter environment. Additionally, Blythedale has a 30-bed pediatric and adolescent unit that provides state-of-the-art care that is child and family friendly to its core. Double-bedded rooms are spacious and offer comfortable sleeping accommodations for caregivers. Blythedale's Comprehensive Assistive Technology Program, one of only a few such programs in New York State, expands opportunities for children with special needs to increase participation in school settings, build social interactions, and access their environments in a variety of specialized ways. Blythedale's dedicated team includes accredited assistive technology professionals from speech-language pathology, occupational therapy, and physical therapy, as well as a rehabilitation engineer. On this floor, we care for several different types of patients. Patients with complex medical conditions, including heart transplants, patients on ventilators with pulmonary needs, complex surgical conditions, and a variety of other medical issues. These are children that have complex medical needs as well as the need for comprehensive and intensive rehab. The team that treats these patients includes a pediatrician, a nurse practitioner, a rehab doctor, social workers, and skilled nurses. It's done in coordination with the hospitals that provide our referrals. We keep in good communication with these facilities. We want these children to get the best of care, and we want our referral hospitals to know what the outcomes are.
Thanks, Kathy. As you can see, we're really proud of the work we do here at Blythedale. We really believe that what we're able to do is help kids get out of the ICU faster while we manage their medical needs and at the same time get them started on really important rehabilitation. This helps with throughput throughout the acute care hospitals, but also in the end is really what makes the children have the best outcomes. We're able to get 91% of kids home who come here, and with an average length of stay of 4 to 6 weeks, it's really time well spent. We hope in the future you'll be able to come and see us in person. Until then, I hope you enjoyed this virtual tour, and I look forward to meeting you.